in 2 days time I'm going to have my third C-section to deliver this lump, and I'm finally getting around to pack my bag. So I thought I would talk you through how I approach this from the perspective of someone who used to work on the labour ward and has seen women come in with everything from 4 suitcases in the kitchen sink to a holdall with nothing but a couple of nappies. Let's run through it. Now I'm probably going to go to the hospital in like my usual casual trousers, jeans, shirt kind of thing, but afterwards you're going to have a wound on the lower part of your tummy, and the most important thing is to keep anything away from this. That means no cute little underwear, nothing low cut. My biggest recommendation is granny pants. I am normally a size 8 and these are a size 12. But the most important thing is you can see like they have a really high waistband here, so they're going to come up quite high on my tummy, and that means that they're not going to rub. There's going to be no elastic that could press and cause any kind of discomfort on that wound. Sometimes the other thing I like to do is even though they're going to be bigger, is you can slightly break the elastic, and that means that even if they do slip down, they're not going to be so tight and pressing on the wound, because where the wound is usually the band of a lot of modern underwear. The other thing to consider is what to wear after delivery. You can stay in the gown. I usually stay in the gown for a little, until I feel like getting up and having a quick shower and putting on my own clothes. And honestly, there's nothing fancy about this. Some people will like to wear nighties that have these buttons at the front so that you can open them out and have skin to skin. If you want to breastfeed, skin to skin is really important, especially at the beginning, to help stimulate the hormones, help your milk come in, help the baby to get to know you and find your breast. I find it equally as easy to use these tank tops. This is just like an old tank top. You can pull the strap down, and baby can get on with it. Nighties I find a little bit better because again you don't have to worry about the waistband of the pajama bottoms. This time I'm going to be delivering in winter, but my first 2 children were born in the summer and autumn. In my experience, there is no postnatal ward that isn't a burning furnace anyway. They like to keep them really toasty for the babies, so you don't need to worry too much about keeping warm or keeping cool, but think about some loose layers. Maybe if you're someone that feels the cold, like a fluffy dressing gown or a light hoodie might be better for you. The other thing is footwear. Now this time I'm going to be taking some fluffy slip-on slippers that I don't need to bend down to put on, but that's because it's winter. Last time I did just take flip-flops to walk around the ward and go to the shower. Again, something easy to slip on and comfortable is the key. And then there's some essentials that I have in my, I don't know what you call this, vanity bag. So obviously toothbrush, toothpaste. I have like a nice thick moisturizer because the wards, as I said, they're often really warm and your skin will become quite dry. I swear by this Lucas Pawpaw ointment. You can use it for nappy rash, you can use it for your lips, you can use it for your skin. It's really moisturizing, and so I always pack this because it's a nice all-rounder. And then the other really important thing is water. So I always have my massive bottle of water that I fill up and take with me, but I also have a selection of electrolytes. I'll probably have 1 of these a day diluted into my water bottle because it just helps to keep you hydrated. So you don't want to be drinking lots and lots of plain water. A little bit of salt in it is better for the hydration. Lastly, maternity pads. The bigger, the better, just comfy. You will bleed after a C-section, and although it becomes less each day, sometimes at the beginning it can become quite heavy, particularly when you go from like sitting to standing, you have a shower, or if you're feeding baby, your womb will contract and you might lose some blood then. So in your massive pants, you can have a massive sanitary pad. And those are the things that I think are essentials. Apart from that, it's up to you. Things to think about are your electronics. So you want to think long cables, because often when you're in the bed, the socket is behind you. So it's got to go all the way across your bed and then into your hand if you need to charge. And trust me, you don't want to be twisting and reaching when you've had a C-section wound, because minimal movement of the tummy is key. I'm going to take a fully charged Kindle. You might prefer a book or an iPad that's preloaded with Netflix. You might want snacks, although there's something special about the hospital tea and toast, I have to say. If you wear makeup, anything else that's going to make you comfortable in those first few days after delivery. For the baby, you'll need nappies, baby grows, cotton wool or wipes, maybe something to swaddle. Personally, I don't swaddle. If you do, then you'll need something to swaddle. You might want to think about bottles if you don't want to breastfeed. Really, those are the essentials. It's not that much. It's not that big of a deal. If you forget anything, I'm sure someone will be able to pop to the shops or a quick Amazon Prime. And don't worry, you've got this. I'll see you on the other side.